Most women are well aware that estrogen is a key ingredient to ensure vaginal elasticity and lubrication. But less appreciated is that testosterone receptors are also found in vaginal and vulvar tissues and are also key contributors to vaginal health. DHEA, or dihydroepiandrosterone, is the building block that's required to manufacture both estrogen and testosterone. Now, normally, women make DHEA in the adrenal glands, but with age comes a significant decline in DHEA levels. So DHEA vaginal suppositories were developed because by supplying those building blocks for estrogen and testosterone, your body can manufacture its own estrogen and testosterone. And DHEA suppositories are also known as prasterone. The trade name is Intrarosa, and I want to mention I have no financial ties to this product. But Intrarosa is a non-estrogen prescription alternative to treat vaginal dryness, an alternative to the local vaginal estrogens. So the suppositories come with an applicator, but honestly, most of my patients simply just push these bullet-shaped suppositories inside their vagina using their finger. It's actually not only not necessary, but it's best not to push the suppository too high, since most estrogen and testosterone receptors are located in the lower third of the vagina. The DHEA then works inside vaginal cells to stimulate your body's own production of both estrogen and testosterone. In clinical trials, DHEA has been shown to have all the effects of local vaginal estrogen, including things like improving vaginal pH, lubrication, and elasticity. Some studies even show that women who use vaginal DHEA have an increase in libido and orgasm beyond what's expected from eliminating painful sex. Now, vaginal DHEA supplementation does not stimulate breast or uterine tissue, which is very reassuring. The only complaint I have from my patients is that some women say it makes them too juicy, and if that's the case, well, then you can use an every other day application. Now, I'm often asked if DHEA works better than local vaginal estrogen. Well, there's no head-to-head studies that definitively answer that question, but given that it stimulates the local production of both estrogen and testosterone, it stands to reason that it would. And anecdotally, I've had many patients who have better results with DHEA than they do with using a local vaginal estrogen. The other question I get all the time is DHEA safe for women with breast cancer? Well, while the amount of estrogen produced by DHEA is ridiculously low, it's not zero. But of course, I maintain that local vaginal estrogen is safe to use in women with breast cancer. But most important, the breast surgeons and oncologists I work with are very comfortable with patients using vaginal DHEA. Having said that, if you're not comfortable with even a minute amount of estrogen, you may choose to go a different direction, such as a long-acting vaginal moisturizer or maybe vaginal laser.